Hello everybody, Sanbonani Dumelang Absheni, hello. Hello to my fellow neuropsychologists, hello to my neuropsychologist in training, hello to those that want to be neuropsychologists one day, and hello to the people who just like me as a person and who are just here for vibes. Hello to the people that just like psychology, just hello everybody. We are in, what month is this? April, and we're almost done with April. And I'm recording my first video of 2025. It's been such a crazy year. And I've just been thinking, Mo, you need to record for YouTube. And I haven't been doing it, and I am so sorry. I did mention in I mentioned it in a conversation that I had with one of my colleagues, and they were asking me, why am I not recording for YouTube anymore, and why am I so quiet on YouTube? And I explained that I actually don't know what to do with the YouTube channel. There's only so much I can tell you about getting into the program, so I really struggle with knowing what to do and figuring out what to do with the channel, and that's part of the reason why I'm so quiet. I don't think I want to vlog. I vlogged. I like the idea of vlogging, but I don't think I want to vlog. I don't think my life is that interesting, that like from an academic point of view. All I do is school. So I don't think I want to vlog much. So because of that, I didn't know what to do with this channel. I genuinely didn't know what to do with this channel. So I have decided to start looking at different conditions that exist in neuropsychology and chat and explore conditions that lead you to a neuropsychologist. Basically, why would you need to see a neuropsychologist? Why would anyone need to see a neuropsychologist? And I mean, there are so many psychologists out there, right? In terms of there's so many types of psychology. There's industrial psychology, there is clinical psych. There's so many types of psychology that one might ask, why neuropsych? Like, why did someone feel the need to create another different type of psychology? Like, weren't we fine with all these other branches of psychology that we currently have, or disciplines in the psychology space that we currently have? Why the need to have another type of psychology? And what type of patients go to a neuropsychologist? And I think that might be where I'm moving to with this channel. I'll still answer questions that are related to the UCT program, and I'll always say I'm a bit wary about talking about the program itself, because I'm not sure, and maybe I must actually ask someone at school, I'm not sure how much I'm allowed to share about the program, but I will do videos on that every now and again. But I think for now I would like to get us talking about different conditions that that lead you into a neuropsychologist's office. But this video is not about that. That will be a completely different mini series. Completely different videos on that. This is a catch up. As much as I said I don't want to vlog, but this is a catch up on what the M2 year looks like when you're studying neuropsychology. For those that want to get into the program, this also gives you an idea of what your year 2 is going to look like. I mean, I did say last year, what is this? Looks like this. What's my papers? I did say in my video that last year what we did a lot of coursework. We did neuroanatomy, we did neuroimaging, we did neuropathology, because as a neuropsychologist, you need to know how the brain is wired, first and foremost, like what a healthy brain does, what a healthy brain looks like. Then you need to know pathologies of the brain, okay? Before we even get to pathologies, so you need to know what the brain looks like, what the brain does, so how a healthy brain functions. Because as a neuropsychologist, you are basically a brain function, brain behavior specialist. So you specialize in this is what the brain does when it's not functioning the way it's supposed to function, and you can assess that, and you can assess that, and you can diagnose that, you can evaluate it. Like, that's your job, our job. So a neurologist will say, this is the neurological condition that I am diagnosing this patient with. This is the fallout that we're seeing. As a neuropsychologist, I then say, based on the condition that the neurologist has now diagnosed you with, these are the outcomes of it. These are the fallouts. If someone has a stroke on the left side of their brain, the neurologist will confirm that yes, this person has a stroke. On this part, on the left side of the brain, on this part of the left side of the brain. As a neuropsychologist, I then say, okay, I'm already, as a neuropsychologist, you must already be thinking, okay, stroke on the left side of the brain is in charge of language, right? And other things, of course, but like there's your language centers for majority of us are on the left. So as a neuropsychologist, when I hear stroke on the left, I'm already thinking, okay, some type of language fallout might come out of this. Some type of aphasia I might be dealing with some type of aphasia, So for me to get to the point where I can even be like, okay, stroke on the left, these are the possible outcomes. I need to know what the brain does, what the left side of the brain does, and what different regions in the left side of the brain does, what the right side of the brain does, and what different regions of the right side of the brain does, what the brainstem is in charge of, what the cerebellum is in charge of. The brain is divided into many segments, and I need to know all those areas and all those regions, what they do. So that's why we do neuroanatomy. Fine. So now, on top of that, you also need to know how the brain is supplied, you need to know the vasculature of the brain. I'm trying to use layman's terms. You need to know blood-brain supply. You need to know which arteries supply which part of the brain. Yes, you need to know which arteries supply which part of the brain, because when you're told that the patient has had a stroke, you'll be told exactly the region or which artery was involved, and now you need to immediately think, okay, this artery supplies this part of the brain, this part of the brain, this part of the brain, and this part of the brain usually does 1, 2, 3. Okay, so I'm expecting fallout in 1, 2, 3, because you are the person that we come to say, okay, how is this person functioning now after their stroke? How is this person and if can this person had a stroke on the left side of the brain? We know language. In terms of their language, which part of their language is affected? Because you must remember, language has it has comprehension, it has repetition, it has production, it has reading, it has writing. So which part of these 5 are affected? Is it all of them? Reading and writing, but yeah, I mean, it falls under language, so we also need to check, can this person read, can this person write? But more so, what we check is, can they comprehend, can they repeat, can this person produce speech, because the left side of the brain. Cool. So M1, that's what you do. You learn about that. And I mean, I think if you go back and listen to the one video that I did where I said I was studying for my neuroanatomy exam, I think you'll immediately pick up the difference between how I speak now and how I spoke then, because how I spoke then, I had very limited knowledge. I basically knew nothing. I'm not saying I know everything now, but I know a lot more than I did then. So it was 1,000% important that we do all the things that we did last year, and I get it. So we did neuroanatomy. which of course you will also learn how the brain is supplied, like in terms of the blood supply of the brain. You learn about that. You learn about the sutures in the skull. You learn about the divisions of the brain, the functions, all of that. Now you know what a functioning brain looks like. Then we go into neuropathology. You now learn about different pathologies of the brain, neurological pathologies, functional, organic neurological disorders, and then functional neurological disorders. You learn about both, because the functional ones are the ones that are caused by some psychological factor. It's not like the brain itself has a neurological damage. It's a presentation of it presents like a neurological condition or a neurological damage, but there's no actual neurological damage. Like the brain itself is not damaged, right? But you also learn about like the damage of the brain. You learn about swelling of the brain. You learn about all sorts of, you learn about meningitis, you learn about infectious disease, you learn about neurodegenerative diseases, your likes of dementia, you learn about different types of dementia also. Like you'll go into great detail and you have an exam, so good luck. But you'll go into great detail about all the pathologies, all the pathologies of the brain. Cool. Now you know what a healthy brain looks like. Now you also know the type of, what time is it? Oh, I have a tutorial at 4, so I need to leave because I had a gap now, and I was like, let me record a video quickly because I haven't reintroduced myself in 2025. And then, so now you know about the pathologies of the brain. Now you need to know how to read a brain scan, and that's why we did neuroanatomy, because now you need to know that, okay, if I'm dealing with a tumor, this is what it looks like on the brain. If I'm dealing with an infarct, this is what it looks like on a brain scan. You need to know you need to know what all these conditions look like on a brain scan. So that is basically your year 1. Of course, you'll do some pediatric neuropsychology, some adult neuropsychology. You'll attend classes for that. You'll write exams for that, but you're not really seeing patients in M1. You are just observing. You are observing the M2s and the interns. You attend their case conferences on Friday, but you are observing the M2s as they do their practicals in pediatric neuropsychology the whole year. That's what you're doing in terms of like patient observation. That's what you're doing. And then once a year you will see an adult neuropsychology patient. Cool. That's M1. You're not seeing much patients in M1. Then M2 comes. Remember when you were in M1, you were observing the M2s online. What are you now? M2. What does that mean? You are baptized in fire. You are put in the volcano. Oh, you are baptized in fire. Allow me to introduce myself. My name is Morongwa Munko Miyende, and I am an M2, and that means I am being baptized in fire. Mzuyacha. Mzuyacha. Anyway, what does your M2 look like for those that want to study neuropsychology? M2, you are seeing a lot of pediatric cases. Basically, the pediatric hospital is ran by the M2s with lots of supervisors. We are under supervision, of course, 1000% of the time. Like the supervisor is always there. You always have a supervisor. How I always describe it to my best friend, I say, this is work, but you're being marked on every time you work. You know how when you're working, I don't know if some of you guys, but most of you guys would be students, but some of you guys are probably employees in some way. At work, you only get marked once a year when there's that KPI meeting, and now there's bonus discussions and salary increase discussions. And that's when you get marked on how you've been doing the whole year. M2, you are an employee that is getting marked on everything that you do. Everything that you do, your supervisor is telling you, you did this wrong, you did this right, do this better, do that better. Like, M2, I'll do M2 again over honors, because honors almost took me out. Honors, talk about honors another day. Honors took, if you want to do your honors, guys, good luck. I mean, you can't do this without your honors, so go do your honors. I'm not saying don't do your honors, but prepare yourself. Prepare yourself for honors. Prepare yourself for honors, because not pop in place. Honors is not pop in place. So M2, you're seeing pediatric cases. There's a roster and everything. You work in pairs. You see a patient, you do your history, you meet the patient, you meet their family, you gather information about them, you know, their upbringing, the parents' main concerns, you know, whatever you need to gather in connection to the referral that you were given, you know, you need to gather all that information, and then you assess them as a neuropsychologist, and then and assessment as a neuropsychologist. Oh, that's also a different video altogether. Maybe I am sitting on a lot of content that I'm not aware of. Let me know if you're interested in finding out. Of course, I can't like share what the test inside, like what you actually do word for word inside, because then, you know, a lot of people will go practice before your assessment, and then the information is spoiled. Basically, you spoiled the test. But there is an overview that I can give 100%, and this is information that you can even find on Google. But I think if you're outside of the discipline, you don't even know what to go look for on Google. So I'll direct you. If you want to know about testing, neuropsychological testing, Google this, and Google will tell you. So basically, I will be your navigator before you get to Google. But yeah, so we assess the patient, and then you write a report. You present the report. M2. You present the report. You're told, well done, take this out, put this in. What did you think about that? Why did you make that decision? Why did you put this in? Why did you test that? You could have tested this. Why did you want in front of Pamgwaban? Okay. Then there's that. So there's M2, the pediatric side. And you still have your research that you need to do, because remember, this degree, your master's degree, is 50% coursework and 50% research. So we're still working on our thesis on top of all this mess. And we're still tutoring, because I said I have a TAT 4. And we're still tutoring. Excuse me. Oh, I've tutored so much this year. I've never tutored this much in my entire life. I'm tutoring so much this year, and that's also part of the reason why I actually feel like I don't have time to record for YouTube, because I'm like, half the time I'm sitting at my laptop marking, because there's just so much marking when you tutor that it's almost the only thing that it's almost like I'm a tutor and then a part-time neuropsychology student. Like, it's like, this is part-time. Majority of my time is just taken by tutoring and tutoring related stuff. And so that's why I'm just like, I don't know how to share, because my life is so it's not boring, but like it's repetitive, it's redundant, it's like there's nothing else there to share. But let me know if you want 1 or 2 vlogs for M2, so I can give you an idea of what it looks like from when I get the referral, so I can, you know, do a video where I'm like, oh, okay, just got a referral for my next patient that's coming, and I can tell you how many days I have between the referral to when I actually see the patient, and her family, and then like I can give you timelines of how I work, what I'm doing, what I'm doing in the meantime, what I do to prep, those type of things I can of course share. But let me know if you're interested in that. And then so that's the pediatric side, because as a neuropsychologist, you're going to work with children, and well, after you're done with the training, you can decide to work with children, or you can decide to work with adults, or you can decide to be a generalist and do both. But some people more often than not do one, because the way an adult brain functions is different to a developing brain, and some things that are fixed an adult brain won't be fixed in a child, but some things that are fixed in a child, not really, but something that are happening, let me use that word, some things that children do, adults don't do. Most things adults don't do. So you can't expect the two brains to react the same to things. A child and both people can have a stroke in the same area, and I mean, even two adults can have a stroke in exactly the same area, and the fallout will look somewhat like, the outcome will look somewhat different. It won't be like different in that the stroke is now on the right, but now language is gone, type of thing. I've never seen that, but I just got here. Maybe it happens. But what I'm saying is, the stroke might be on the left, where that's the language center, and but like the patient people are different, and that's why neuropsychology is so important, because what we do is we take into account the entire person, we deal with the holistic individual. We're not just dealing with the psychological part of it. When someone has a neurological damage or neurological injury, we take that into account. But also, unlike neurologists who just focus on the neurological injury, we look at the psychological part of this person. We look at this person's upbringing. We look at this person's highest level of education. Someone who's extremely smart, who's extremely learned, who went all the way with academics and whatnot, is not going to have the same response to having a stroke to someone who's maybe never studied or didn't read much or whatnot. Like, their cognitive reserve is much less. So someone with a higher cognitive reserve, when they have whatever neurological injury that they have, it might present a lot differently to someone with a lesser cognitive reserve. So we as neuropsychologists, we take this person's, like, the entire person is taken into account. Where you grew up, how you grew up, how that affected you, and we do that more, especially on the adult neuropsychology part of the program, because this person has lived. As much as this person might be coming to us because they've had epilepsy, and now we need to assess that based on their epilepsy, this is how their brain is functioning, But we also need to take into account who this person lives with, what this person has been doing for their like, what's their occupation, what's their highest level of education. All these things need to be taken into account, because even though you might have an epilepsy that's similar to somebody else's epilepsy, but what you do at work might require you to focus. And the next person, what they do at work might just be physically taxing, but doesn't require them to focus, So I'll make different recommendations for those two people. I won't make the same recommendation, If I'm being asked, if the referral that was given to me says, can this person go back to work? This person had epilepsy, and we've given them, this person has epilepsy, we've given them medication, the epilepsy is controlled now, can this person work? Can this person go back to work? Can this person go back to the same job that they had? Or should this person find a different job? Is there, now that we've controlled the epilepsy, is there another kind of job maybe that they can do? Maybe they won't be able to go back to their previous job, but is there another kind of job that they can do? You as a neuropsychologist, you, as much as you're going to assess the brain functioning of this epileptic patient, but now you also need to take into account their life holistically. Who are they living with? Who's supporting them? If you like, it's so many. So you take, and that's why there's the psychology part of it, because you have to think of the person, and the neuro part of it, because you have to think of the neurological condition that the person is presenting with. So basically that's the other side of it, the other part of the program, which is the adult neuropsychology. On that side, we deal with adult patients. We'll see an adult patient once a week, and we assess. So we go through their medical file, and then you'll get the medical file. You'll go through the medical file, and then you will write up a young plan, your test plan of what you're going to test based on what you found in the medical folder, and then you go meet the family. You go meet the patient, and you get some history from them based on the things that you didn't get in the folder maybe and whatnot, chat to them and whatnot, and then assess and make your recommendations based on the referral that you got and based on the interaction that you've had with the patient, and of course based on the results that you're seeing, but also taking into account the complete picture and this person's life and what they do for a living, and like just their life in general, what they like, what they don't like, the type of life they living. Are they an active person? Do they live a sedentary life? All those things. You take those things into account and you put that in a report, and that's what we do for the adult neuro psychology part of it. So M2, if you're not tutoring, is going to be your pediatric neuropsychology, your adult neuropsychology, because you start seeing the patients in M2, and then you'll have your research. Unless you manage to finish your research in year 1, which most people don't do. I've never met someone who did. If you can finish that in year 1, then research done. You just have those 2 things. And if you don't tutor, amazing, you just have those 2 things. But that is what M2 looks like. And it's 3:36. I'm leaving in at 3:45. So that is what M2 looks like. It has been a hectic year. It has been a year of growth for me, especially because there's a lot of personal areas. There's areas that I felt last year that I wanted to work on, personal areas that I wanted to work on, that I have been very intentional about. I've never listened to Jordan Peterson as much as I've listened to Jordan Peterson this year. My goodness, because we need to grow. Umuntu needs to grow. Umuntu needs to do better. Like, other people might not be able to see the changes that you're making, but you know how Jordan Peterson always says, clean your room. Like, clean your room. It gives you structure. It gives you order in your day. Like, that thing seems small, and somebody else might not be able to pick it up, but you will pick up the effects of that throughout your life. That there's room in my order, and there's order in my room, and now I want order in my schoolwork, and now I want order in my work. I want my order in relationship. You see the domino effect of you craving order. So there was a lot of personal areas. Why, like, personal areas sounds so weird, but anyway, there was a lot of areas personally that I felt like I wanted to grow in, and so this year has been about me focusing on those areas and just growing those areas, and that is why I decided to tutor as much as I tutored. It wasn't more so for the money. I mean, I like the money, love the money. It's not that much, but like the money. Like, there's small things that I needed to learn, that I felt like tutoring would teach me. Things like learning to control your anxiety, things like being, like, just standing in front of people and speaking, because unfortunately, that's what the program comes with. You're constantly speaking in front of people. You're constantly speaking to family. You're speaking to such a different, diverse population that you need to be comfortable with speaking to people. Yeah, man, just even like I never, oh my gosh, I disliked how my voice sounds, and how I articulate myself. I had such a major issue with how I articulate myself, and that's one of the areas that I've had to work on this year, and I've been greatly working on it this year. And therapy has also helped greatly with that. And okay, tutoring also has helped greatly with that, because like in tutoring, you'll pick up things like you'll say something and the student, and when you ask the student to tell you back what you just told them, they tell you something completely different to what you thought you said, but they are actually telling you what you actually said, so then you realize that I need to learn how to structure my sentences better, so that the message I'm trying to communicate is actually the message I communicate. And I've had to, so it's small things that only I can see and only I could see even last year. But I am working on that. I've learned to, I don't say anymore. I don't use a lot of fillers anymore. Whereas last year, you've said 2 sentences that have 500 in it. You've said 2 sentences that have 500 actually, 500 like in them. Like actually is what your sentence has. Like, kanjani, bro. Kanjani. You can't communicate like that. For where you are going, what you're trying, the type of life you're trying to build, you need to learn to communicate better. You need to learn to articulate yourself better. You need to learn, I needed to learn how to say what I mean, and not use fillers, and communicate the message that I'm actually wanting to communicate, and not allow my own words to sabotage me and to misconstrue the message I'm trying to communicate. So small things like that I would sit down after a tutorial and I'll check within myself. How did you communicate today? What would you have done differently? Knowing what you know now, how could you have said that better? How could you have said this better? And I've learned that, this sounds so obvious, but I've learned that preparation is key. And the level of preparation that's key is a level that I had never thought about before. Yeah, I had never thought about it, but anyway, I'm digressing a lot. But yeah, let me close this video. If you made it to this point, do you think I'm interesting? Because how did you make it to this point? How did you not jump off? Huh? Thank you so much for watching. I am so sorry that I haven't recorded a video this year, but I think I'm back. I think I'm comfortable. I think I now know what I am trying to do with this channel, or what I would like to do with this channel. I don't know if it's going to work. I don't know if people are interested in neuropathology and neuropsychology like that. I don't know if you want to know what type of patients you're going to be seeing as a neuropsychologist, or you're just like, oh, Zowana Pambil, I'll see when I get there. Let's just go. Which is not a great move, because you might start seeing patients here and then you realize, this is not what I wanted to do with my life, and now you are however many years in it. So maybe learning about the type of patients you're going to see is not a bad idea, but each to their own. Thank you so much for watching, guys. Enjoy the rest of your day. Let me go to my tutorial. Bye.